Hello everyone, Dr. Kainat here, and today we are going to talk about anemia. Anemia is a medical condition that is characterized by reduced level of RBCs or hemoglobin that leads to the decreased capacity of blood to carry oxygen. In today's lecture, we will talk basically about pathophysiology of SMA, and then in the next one, we will talk about the pharmacology. So let's start with the pathophysiology of anemia. As you all can see the flow chart, the main causes of anemia, the first one is the decreased RBCs production. The second one, increased RBCs disruption, that is called as hemolysis. And the third one is the blood loss or hemorrhage. So basically there are three main causes. So we will discuss all of them one by one. First one is decreased RBCs production. So how RBCs production is going to decrease? There are three main factors that are going to decrease the production of RBCs. The first one is the nutritional deficiency. Second one, the bone marrow disorder. And the third one, erythropoietin level is going to decrease. So let's start with the nutritional deficiencies. So the first thing in it is iron deficiency anemia. Iron deficiency anemia, there are the different reasons or different causes like the poor diet, chronic blood loss is also a reason, and chronic blood loss happen in the different condition. We will study it in the next one thing. Or the last one is the malabsorption. If we are taking in the iron properly with the help of the food, it means it is not going to be absorbed properly, maybe due to any reason, maybe due to any disease, it is not going to absorb. The second one is vitamin B12 deficiency. Vitamin B12 deficiency causes pernicious anemia. That is also a type of anemia. Vitamin B12 that is going to be absorbed from the your gut, from the GI tract. First one, where it is required, vitamin B12 is required for the DNA synthesis and RBC production. If the level of vitamin B12 is going to decrease, then RBCs are not going to produce properly. It can be caused by autoimmune destruction of your gastric parietal cells. If the gastric parietal cells are not working, they are destroyed, then your vitamin B12 is not going to be absorbed because of the absence of the intrinsic factor that are going to be produced by gastric parietal cells. There are the different causes. First one, again, the poor dietary intake. If we are not taking vitamin B12 properly, if we are taking it properly, then the malabsorption can happen due to any reason. And the third one is autoimmune condition in which the gastric parietal cells are going to be damaged. The next factor is the megaloblastic anemia or folate deficiency. Folate is basically vitamin B9 and that is required for the DNA synthesis and RBC production. The causes again, poor diet, might be malabsorption, it can be alcoholism. Alcoholism also decrease the folate level in your body. In the pregnancy, especially in the pregnancy, the folate level is going to decrease. So these types of anemia can happen because of the nutrition deficiency. And RBCs are not going to produce properly. The second one are the bone marrow disorders. As you all can see, the bone marrow disorder can be of three types: aplastic anemia, leukemia,
and megaloblastic syndrome.
So the first one is aplastic anemia. We all know that the bone marrow is going to produce the blood cells, white blood cells, RBCs, red blood cells, and the platelets. So if there will be any disorder in the bone marrow, it will lead toward the anemia. So the first one, aplastic anemia. Aplastic is a rare but serious condition when bone marrow fails to produce enough RBCs, white blood cells, and the platelets. The reason can be an autoimmune disease. Autoimmune disease can cause bone marrow disorders. Other than this, the radiation that we are going to use to treat the different diseases, it can also lead toward the bone marrow disorders, chemotherapy, or the viral infection or any toxic material like the benzene or the pesticides. These all move toward the bone marrow disorder. The next type is the leukemia. Leukemia is the cancer of the bone marrow and the blood. What will happen in the leukemia? The production of the white blood cell increase a lot. Main causes of leukemia are either it is genetic mutation, either because of the radiation, chemical exposure, or viral infection. These are the basic causes. The last one, myelodysplastic syndrome. It is a syndrome. It is a combination of the different diseases. The bone marrow produces defective or immature blood cell leading to cytopenia. Cytopenia means low blood cell count. Again, the reasons are same: genetic factor, either it is radiation, chemotherapy, aging. So these are the reasons. This is all about bone marrow disorder. If the bone marrow disorder is there, then RBC production is going to be affected. The third one is decreased erythropoietic level. If there is a kidney disease, erythropoietin is necessary for the production of RBCs. So if the deficiency, if there is a kidney disease and erythropoietin is not producing properly, it will lead toward the RBC production is going to decrease. This is the first factor that can cause anemia, and that is the decreased RBC production.
Other factors are going to be discussed in the next video.
If you want to get more information, stay connected with us. Take care. Bye.